Good morning. We're gathered here today on the traditional territory of Treaty 6, and I'd like to acknowledge the Métis people of Alberta who share such a deep connection with our land. Over the week, I'm also joined today by David Shepherd, our health critic for our NDP caucus. Over the weekend, videos surfaced online of Danielle Smith talking openly about forcing Albertans to pay for public health care that has otherwise been long guaranteed to them. Smith said that when she implements her so-called health spending account policy, it would be used to cover all forms of health care, including routine visits to family doctors. That's $375 a year for health care, nothing more. Smith went on to say that people in need of care that exceeded that amount could add to their spending accounts by putting in their own money, by collecting contributions from family members or employers, or by fundraising. That's right, Danielle Smith is literally telling Albertans in need of health care who are unable to pay the thousands of dollars or sometimes hundreds of thousands of dollars that good health care may cost, that their best option may well be to start a GoFundMe page. This is horrific. It's a complete violation of the principles of public health care, of the Canada Health Act, of the very principles, quite honestly, that are part of being Canadian. Now, the video interviews was recorded in 2021, and it came alongside a policy paper that Smith wrote for the University of Calgary School of Public Policy called Alberta's Key Challenges and Opportunities. Strangely named, but nonetheless. In that paper, she argued that the entire budget for general practitioners should be paid for by health spending accounts. She went on to say, quote, "The only option is to allow people to use more of their own money to pay their own way," end quote. Let's be clear. Smith is openly comparing health coverage to car insurance and musing that Albertans should pay a deductible of up to $1,000 whenever they need care. And there's even more. This morning, our official opposition released a second video of Smith, also from 2021, in which she openly touts the value of healthcare premiums. She said putting premiums in place would connect people to healthcare and put more pressure on the healthcare system for reform. But let's be clear what that's about. Healthcare premiums were rejected by Albertans at the ballot box, and that happened for a reason, because they are a regressive flat tax that people who have less income have to allocate more of their income to in order to get the same amount of health care that others are looking for. Taken together, Danielle Smith's agenda is literally advocating for the dismantling of public health care as we know it in Alberta. It means the wealthy will be able to create a healthcare fund so that they can get the healthcare they need, while everyone else is left to do without. Even basic research shows that a Danielle Smith's health spending account would not cover prenatal visits, for instance. It wouldn't cover a single visit to the hospital, which costs over $9,000. An analysis from the US found that a single visit to the doctor can cost hundreds of dollars, thousands if you get the normal tests, x-rays, blood tests, all the other things that typically come from a regular visit to your family doctor. Now, since the first video of Smith surfaced over the weekend, our official opposition has been utterly overwhelmed by messages from very, very concerned Albertans who fear that the UCP are going to destroy the public health care system that we have as we know it. Healthcare is a right in this country. When we are healthy, we are also healthy to go to work, to school, and to contribute to our communities. So, we are here today to demand that Danielle Smith do away with her so-called health spending accounts plan and its associated efforts to make people pay out of pocket for the health care they've always received for free, to do away with it, because it's nothing more than a poorly veiled attempt to make Albertans pay for that trip to the doctor, and to instead to commit here and now that she will not go any further with that, nor will she bring in health premiums. All of this is the very worst version of American-style health care, and it must be stopped. These UCP schemes will chase away investors and employers who are attracted by our public health care system. They will literally look in other parts of the country but stay away from Alberta. They will chase away healthcare workers who are so committed to working in a stable public healthcare system. And most of all, Danielle Smith's scheme means that regular Alberta families will start looking to move to a different place where they can count on their health care, because otherwise her scheme means that getting sick means getting poor. And the sicker you get, the poorer you get. She must immediately, in person, disavow her comments that include all of these radical attacks on public health care that she has described in these videos that have been released over the last few days. And if she won't, I want to tell Albertans this. There is an election coming. The Alberta NDP stands ready to serve. We will work day and night to end the chaos in our hospitals, our clinics, and our EMS. We will trust science. We will focus on solutions. We will respect frontline workers and collaborate with them. And we will recruit more of them too by launching the largest initiative to bring more healthcare workers to Alberta that our province has ever seen. And we will restore hundreds of millions of dollars in healthcare funding that have been cut by the UCP during the pandemic. We will invest more in healthcare because we know how important it is to Alberta families and how important it is to a strong economy. And any government I lead will never make you pay out of pocket for essential healthcare. And we will never introduce healthcare premiums. Thank you. I'm happy to take any questions you may have.
Thank you, and we'll start with questions in person.
Senator Catherine Gurkowski, Alberta Today. So over the weekend, the Premier said, no, this is spin by the NDP. The health spending account will just be for things that are not covered by Alberta Health Services, such as, physiotherapy and medications. And what she said in 2021, that was her as a pundit versus her as Premier or whatever. So what would you say to that this isn't about making you pay for your GP, it's about things that aren't covered?
I would say she's lying, very clearly. I would urge Albertans to watch those videos. They're not videos from 20 years ago when she was doing a theoretical paper as a student. They are videos from 16 months ago. She was not a pundit. She was a public policy advocate, and she was engaging in, I won't say well thought out, but certainly a very long-winded and detailed defense of the idea of making folks pay out of pocket for those fundamental services that we all count on each and every day. And it was very much attached to this notion of the health spending accounts, and she has continued to speak about the health spending accounts ever since. And never has she gotten up to say, oh, I once had this idea about health spending accounts, but I've decided to completely reconfigure what they mean, and they'll only mean this little thing. She's not done that. The reality is, as she has said within the last 16 months, that she passionately believes that Albertans need to consider their relationship with our Medicare the way they consider their relationship with their car insurance company. And that they must therefore, and that they must put more of their own money into getting health care. And these are dangerous, dangerous, radical, destabilizing ideas that in my many years of political life have never heard from anybody close to being in a decision-making position.
And there are, as I mentioned, several services that aren't covered in healthcare, be it pharmaceuticals or counseling. would you then turn around and bring in some of those things into the coverage? Like, what's your plan there if it is a essential healthcare?
Well, I think what the first thing we have to do is stop the delisting that the UCP has been already working on, and we saw the Ernst Young report back in the early part of their term where they were talking about delisting a whole bunch of women's health services, and so we know that that's something that's very high on their list of things to do. At the end of the day, Alberta families need to know that A, there'll be a family doctor available for them, and B, when they go to see that family doctor, it's not something that they have to factor into their budget that month. We heard from a family over the weekend who described having several weeks of having their newborn child in the NICU. And Dad was super concerned that this would have cost them like $200,000 if we'd continued down this road of people paying for their own health care. But even if that hospital care continued to be paid, the reality is that baby is going to need to go to see a family doctor at least once a month, probably more frequently than that, for a long time. And that would long be not covered under this so-called health spending account. Now, when you talk about counseling, I do actually agree on the matter of counseling, and that's why our party has proposed a plan to give all Albertans 5 free counseling sessions with psychologists in order to start to break down that private funding model that happens with mental health care in Alberta. It's not the full answer, but we're trying to make progress there. So yeah, we would expand. But let's be clear, what Danielle Smith's talking about, she's talking about American-style credit card medicine, and where folks who are sick cannot count on getting the care they need when they need it if they don't have a whole heck of a lot of money in the bank.
We'll go to questions on the phone. Just a reminder to press *9 if you're on the phone, raise hand function if you're joining us via Zoom. If you could say your name and your outlet at the top. We'll go to our first caller.
Dean from CP, can you hear me?
Yep.
Yep. Okay. So I just wanted, so what you're saying, I mean, it's, as Kat pointed out, these HSAs aren't talking about doctors, but your position is this is just the thin edge of the wedge and this is the foot in the door and then we will see GPs. I assume that's what you're talking about, right?
Yes, well, if you look at the videos, she very directly does talk about doctors. She makes it very clear that in the videos that she is talking about visits to your general practitioner being paid for out of the health spending account. And if you need to go to see your general practitioner more frequently, then you'll need to start putting your own money into the account, and you'll need to start asking relatives for money, and you'll need to start negotiating that into your employment contracts, and you'll need to start fundraising. That's what she said in the video within the last roughly 16 months. So this isn't us projecting. This is us listening to what she is telling us. When someone tells you who they are, listen.
Okay. What about her whole argument is predicated on the system as it is and doesn't work, and it's at some point it's going to become untenable in terms of cost, and therefore, and the civil service is not able to fix it, and therefore we must pursue this option. What do you think about that argument, and also if you can get your thoughts on her thoughts on charter hospitals, private hospitals?
So let me say, first of all, this is an old, well-worn page out of the Conservative playbook where you starve the public health care system and then you work very intentionally to create an appetite for private funding of healthcare. This game has been going on in Canada, quite frankly, but particularly in Alberta, for decades, ever since we've had Medicare established here. So it is true that our healthcare system is in crisis. It is true that the UCP has driven much of that crisis. It is true, therefore, that we must change governments in order to get one in place that is committed to fixing the crisis within the overarching overarching principle that all Albertans should be able to get the health care they need when they need it, regardless of how much money they have in their pockets. That is my answer to that critique. There are many, many things that can be done to fix the healthcare system. She is doing the opposite of most of them right now.
We'll go to our next caller.
Hello, Ms. Notley. It's Sarah Ryan from Global News. The Premier is set to speak to the province in a public address tomorrow. So I'm wondering what things you would hope that she would use her 8 minutes to talk about.
Well, obviously in this case, I would call on her, if she hasn't done it by then, to specifically state that she has no intention of setting up any plan for any currently listed services to ever be paid for by Albertans through insurance or any other private funding in any way, shape, or form. That is a thing she must declare. If she has the unmitigated gall to go on and try to claim she's talking about, say, affordability and fighting inflation at the same time that she is scaring Albertans with the idea of them having to pay potentially thousands of dollars should they get sick, well then, no one's going to hear her and no one's going to care. So this is a critically important issue. She has made some incredibly radical statements. No one in a position of authority like hers in our country has made those kinds of radical statements, and she must disavow them in front of as many people as possible.
Any follow-up, Sarah?
Yeah, if I may. More generally, Ms. Notley, is there anything else that you would hope that the Premier would speak about tomorrow?
Well, certainly we are hoping that we'll get an opportunity to be part of that address, because certainly that is the precedent. And the one time when we were in government, when we used taxpayers' dollars to buy time on TV, we also allowed for the official opposition to have some access to that time as well. And I think we're a little bit outside of 24 hours, and we've not yet gotten any indication that that is definitively going to be offered. So she can probably explain why it is. She thinks she doesn't have to follow those rules. But also, listen, what we need from this Premier is a rational plan that reflects that she's actually listening to Albertans and is focused on dealing with the multiple ways in which affordability is becoming a crisis at Alberta dinner tables. And there are so many ways in which this UCP government has piled costs onto Alberta's families. There are a number of ways in which she can undo some of the damage that they have done over the last 3.5 years, whether it be utilities, whether it be tuition, whether it be property taxes, whether it be car insurance, whether it be higher taxes through failure to index, all those kinds of things. She needs to talk about how she will undo the UCP record of making things more expensive for regular families.
We'll go to our next caller.
Hi, it's Lisa Johnson calling from the Edmonton Journal. I just wanted to go back to something that you mentioned. I'm a little bit confused. You mentioned that the UCP needs to stop delisting services. Are there services that they've delisted recently? I'm not sure what you're referring to there.
What I was talking about there, Lisa, was the Ernst Young report that came out just before COVID, where they were threatening at that point to delist a whole range of services. So I was referring to that. Now, I don't think they've moved ahead with some of them because we did see COVID, but we know very clearly that the concept of delisting pre-existed Danielle Smith, and at the same time, she's spoken very openly since that report was done by the UCP about the need to bring private dollars into the payment of our public health care system.
You follow up, please?
Gotcha. Thanks. Yeah, I understand wanting to remind Albertans of these past statements and some of the thinking that has gone into the Premier's personal health spending account. I get that, but this feels a little bit disingenuous. When Danielle is literally tweeting saying, no, I'm not going to do this. I'm not going to make Albertans pay for services that are covered publicly, that are covered under the Canada Health Act. She's saying this, and you're saying, well, she's lying. I mean, is this really the level of political debate that you want to have in this province, where you're just both calling each other liars? I mean, at some point we have to take her at her word that she's not proceeding with some of the ideas that she proposed in this U of C paper?
Well, what I would say is that we have her on video within the last 16 months making a very passionate case to make radical changes to our public health care system and to force folks to pay out of pocket for their health care. Now, it is all lovely that one of the 10 people who still works in and around the Premier is tweeting things under her name. What I would expect, based on the severity and the gravitas and the danger associated with the incredibly radical and damaging ideas that she's articulated on film in the last 16 months, that she must do the same on film. I'm sorry, a random tweet done by one person does not counteract, an exceptionally detailed and passionate case being made to privatize the funding of big, important parts of our healthcare system. The two don't add up. And so if she wants to come in and go on camera like I am right now and take questions and very clearly explain to folks that she has learned a whole bunch of new stuff and that these previous ideas are wrong and she will not now or ever pursue them, I will be very happy and I will feel that my job as leader of the official opposition has been done. But until such time as we see that from her, it's just not good enough.
We'll go to our next caller.
Yeah, hi, Rachel. It's Michelle Belfontaine from CBC. I just wanted to follow up, though, on what Lisa was just asking. I mean, she has said that that it's not going to be. It's only going to be for things that are not publicly insured. So, I mean, you're saying that she said this on video like a year and a half ago. Well, aren't people allowed to change their minds? Like, maybe she's changed her mind. It sounds like she's changed her mind.
Well, I haven't seen her in person say that. And so I would like to see that. And moreover, what she is doing is she's moving forward and talking about moving forward with these health spending accounts. And she has offered up some very concerning views on healthcare in general. And as I say, the destabilizing and damaging level of just generally, let me back up a bit. The degree to which these policies will hurt Albertans, the severity of them, the seriousness of them are such that she needs to come on person and answer for them. Because, as I say, this is not a paper done by a grad student 15 or 20 years ago. This was something that she believes was well thought out 16 months ago. And she has continued to talk about health spending accounts with great enthusiasm. And and she's also argued that, in the last few months, that cancer is something that really is in everybody's own hands in terms of prevention until they get past stage 3. So, I mean, there's just a lot of ideas that are deeply concerning, and she needs to clarify this. It's just not acceptable to have this kind of record out there without her in person very clearly stating that the impassioned defense of private health care that she articulated was wrong and that she will not pursue it now or after the election. To be clear, Danielle Smith has a strong and long record of changing her mind, if you want to put it that way. That her whole career is defined by her changing her mind. So exactly why is it that we should be trusting that she won't change her mind again? based on the level of passion behind her defense of private health care that we saw in those videos this weekend.
Any follow-up, Michelle?
No, I'm good, thanks.
Do one more pass for questions, and we'll take one more in person, and then we got to go.
Yeah, I just want to go back to what you said about the technique of privatization. You know, you ruin the system and then bring in private capital to solve it. Mm-hmm. Some people might say, they might agree with Smith and say, hey, I've got some money, maybe this will free up space in the public system. What's wrong with doing this? So what's your argument against it?
Well, I now sort of unfortunately end up starting to sound like a bit of a policy wonk, and I don't want to. But the bottom line is, if you create a two-tier system, there will be two different levels of care available for people depending on whether they have access to one tier versus the other tier. Moreover, when you have a dramatic shortage in frontline healthcare professionals, you will steal from Peter to pay Paul, for all intents and purposes, and there will be a difference in terms of the quality of healthcare that people can receive. And also, it will cost everybody more overall, and evidence from the U.S. is unequivocal on that. The United States, in the U.S., they spend about 40% more than we do on healthcare, with overall much lower results, higher mortality rates, earlier death rates, higher infant mortality, all the things that you can't massage, the U.S. does worse on than we do, even as they spend about 40 or 50% more than we do. So that's what happens, and that's why we can't let that be something that we allow to happen here in Alberta.
And that's all for today. Thank you.
Thank you.